Welcome back to Mornings on 2. It's 5:15. Many people are looking for a solution to hair loss. It's a very personal issue and can happen for a lot of reasons. Now there may be help from a surprising source, a blood pressure pill. Fox News medical team's Dina Santafanti joins us now to talk about this. Good morning, Dina. First of all, tell us how a blood pressure pill may help with hair loss and how was this discovered?
Well, it's interesting, isn't it? And I was actually talking to a dermatologist about something else, and he said, look, I want to tell you about what I've been doing for about the past year or so with my own head and for my patients, because people, whether it's post-COVID, whatever the issue is, hormonal reasons, there's hair shedding, there's hair loss, there's thinning hair. And this pill, he said, is making a difference. So let's go back a little bit. It is a Minoxidil. Now, that's the active ingredient in topical hair treatments like Rogaine, but now many others too, because it's generic now. So the idea is when this medication's been around for a long time, Pam, by the way. It was originally developed as a blood pressure medication, and then it was discovered, boy, people are growing hair. So it sort of, there was a pivot there. Now, it's been available in this pill form for a long time, but for the most part, people shied away from it because they worried about other side effects. But now there's been new research done on it that shows how effective it is. Listen to what the doctor has to say.
Well, when you talk about oral minoxidil, I'm not just the doctor telling you about it. I've personally been taking it for a year, and it's dramatically grown my hair. So I have now hundreds of patients taking oral minoxidil. It's very reasonable price-wise. It's now a generic. It's readily available, very few side effects.
Okay, so that's Dr. Grecken. Now, a couple things to point out that when you take, and part of the allure to taking the pill is that you're not rubbing something on your hair, and some people found scalp irritation when they try to, and it's a nuisance to be rubbing something on your hair twice a day, messing up your whole flow, right? So taking the pill seems a little more appealing. You do have to know that taking that pill will cause hair to grow in many places. So he says for women, he recommends half a pill. Men take the full pill. Because you don't want to worry about hair growing in places that you don't want it to grow.
Certainly not.
Will grow
Certainly not. Yeah, now what about if you don't have high blood pressure? Could you still take this pill? Is there
Yes. So this is
with that?
off-label usage. It's no longer really a treatment for high blood pressure. This is off-label usage, and it is strictly now being used as a hair growth option, as opposed to a high blood pressure medication. So that's what you have to ask your doctor about.
Okay.
Now,
great.
and as far as does it work better than rubbing it on your head, the studies are a little mixed on that, but for many people it's just way more convenient.
So it's the same ingredient, just maybe more convenient. Okay.
Yep.
Great. Dina Santafanti with our Fox Medical team. Thank you for that. Very interesting.